epidemiologist, Dr. Christina Tan, Assistant Commissioner of Health for Public Health Infrastructure, Laboratories, and Emergency Preparedness, Chris Newworth, Hackensack Meridian Health Regional President, Dr. Ihor Sawchuk, Attorney General Gurbir Grual, State Police Superintendent Colonel Pat Callahan, and Director of Homeland Security Jared Maples. As Governor Murphy and I announced last night, along with Commissioner Persichilli, we identified our first presumptive case of coronavirus in New Jersey. That individual, a male in his 30s, is currently hospitalized and stable at Hackensack University Medical Center in Bergen County. We are working with our partners in New York closely to carefully trace all points of contact for this individual. Additionally, a second presumptive case has also now been identified. The Department of Health, along with our local and federal partners, is working hard in responding to these cases, and Commissioner Persichilli will speak more to both of these in just a moment. In addition, the administration has issued immediate restriction on all state-related business travel. All international travel is suspended for our state workforce until further notice, and previously approved international travel by our state employees is canceled. All domestic out-of-state travel on state-related business must be approved by the governor's office, including same-day travel, whether that be to New York, Washington, D.C., or elsewhere. And we advise caution of our employees traveling to any area with known impacts of community spread of coronavirus and COVID-19. I would like to reiterate two things that the governor and commissioner both said repeatedly on Monday. One, this case does not come as a surprise. Our state has been prepared for weeks for the eventuality that one of our residents would test positively for coronavirus. We put in place a plan for preparedness and rapid response, and that plan is working. As you know, Governor Murphy assembled an interdepartmental task force, and that task force communicates on a daily basis. Second, and more importantly, the threat to public health in New Jersey remains low. We urge residents to remain calm, and it bears repeating. This is cold and flu season, and residents with respiratory ailments are more likely to be suffering from a cold or flu, not coronavirus. Lines of communication remain open to all. Anyone with questions or concerns should first visit the Department of Health's coronavirus information page at nj.gov/health, or call the state's toll-free public hotline at 1-800-222-1222. And as a reminder, the surest way to protect yourself and others is to wash your hands frequently with soap and water, to cover your cough or sneeze, and to avoid touching your face, your eyes, your mouth, your nose. If you are feeling sick, take a day off from work or school and call your doctor or local healthcare practitioner. These are all simple things and common sense things, and they are our best defense. As we said, the overall risk of coronavirus is low. If you feel under the weather, it is most likely a seasonal cold or flu, not coronavirus. From the governor to me, Commissioner Persichilli, and to everyone that is standing up here with me, our teams across government, we have been preparing for this for weeks. And because of that, we are being aggressive in our investigation and in ensuring public health. I'm going to now ask Commissioner Judy Persichilli to further brief you.
Thank you, Acting Governor Oliver. As I said in the past, given the expanded testing and continued spread of novel coronavirus worldwide and in the United States, it would not come as a surprise that we would have a positive case in our state. We were notified last evening of our first case. I'm here to report this morning that we have just been notified that we have another presumptive positive case, which will be sent to the CDC for confirmation. When I say presumptive, I mean the sample was tested in our state labs in West Trenton and is being submitted to the CDC for confirmatory testing. State and local public health authorities are proceeding with their investigations and responding to these activities in our recent notifications. Here's what we know so far about the individual. The case is a male in his 30s who's currently hospitalized in Bergen County and is currently stable. The individual developed symptoms on March 1st and then sought medical care late on March 2nd, first at an urgent care facility in Bergen County, and then was sent to the hospital ED, emergency department, and was subsequently admitted. The hospital appropriately placed the patient in an airborne isolation room since his arrival, and the facility has since been continuing appropriate infection control precautions. From the time he became symptomatic, the patient had limited close contact with other New Jersey residents outside of the healthcare setting. The New Jersey Department of Health, in conjunction with the local health departments, are in the process of identifying healthcare, household, and other close contacts of these cases. These contacts would be assessed as to their level of risk of exposure to the case, and other close contacts would be asked to self-quarantine and monitor for symptoms for a period of 14 days. While we are still investigating the patient's possible source of exposure to the virus that caused COVID-19, at this time we do not have information linking this patient to the Westchester COVID-19 cases. I know even one case of COVID-19 is concerning to the public. There currently is not a vaccine to treat COVID-19, but there are steps you can take to protect yourselves. You've heard this repeatedly. Wash your hands frequently during the day for at least 20 seconds. Use alcohol-based hand sanitizer at 60%. Cover coughs and sneezes. Staying home when you're sick. Avoid close contact with people who are sick. Avoid touching your eyes, your nose, or your mouth. Add clean and disinfect frequently touched objects and surfaces using regular household cleaning spray or wipes. For individuals who have recently returned from China, Iran, Italy, and South Korea, where CDC recommends you avoid all non-essential travel, CDC and the Department of Health are advising that they self-quarantine, self-monitor, and practice social distancing for a period of 14 days from the time the individual left the area with widespread or ongoing community spread. Yesterday, we also issued a notice that any New Jersey resident who attended religious services or religious events at the Temple Young Israel in New Rochelle, New York, on February 22nd or February 23rd to self-quarantine until March 8th. Self-quarantine is an important public health tool used to separate and restrict the movement of people who may have been exposed to a contagious disease to see if they become sick. As COVID-19 spreads across the United States, we will expect to see more cases in New Jersey. Currently, we have 8 persons under investigation and awaiting testing. So far in New Jersey, we have tested 13 individuals. 11 were negative, and as of a half hour ago, 2 have been reported as presumptive positive. However, these numbers are changing rapidly as the number of providers contacting public health to request testing is expanding. The Department of Health has been monitoring this global outbreak since the first week of January to ensure our preparedness at all levels throughout the state. Our teams continue working around the clock to respond to this and any potential cases that come our way. Our internal management team continues to meet daily and assess our response. The New Jersey Coronavirus Task Force, chaired by me and comprised of other state departments and agencies, is coordinating all state efforts to ensure that we are taking a whole of government approach, as the governor says. We continue meeting weekly and working with each other on a regular basis. We've been hosting conference calls and meetings with local health departments, hospitals, school superintendents, and college presidents. Members of our business community have been on conference calls with us, and local and county officials have been in constant contact for our preparedness efforts. We continue working with these groups to address all of the stakeholders' concerns. We are planning more calls with stakeholders, such as long-term care facilities and child care centers next week. Our coronavirus webpage, available at nj.gov/health, is updated regularly with FAQs, fact sheets, travel advisories, and guidance for businesses, universities, schools, and healthcare providers. We encourage residents with questions to call the public hotline run by New Jersey Poison Control Center at 1-800-222-1222. Trained healthcare professionals are standing by 24/7. They can answer your calls in a variety of languages. So far, the call center has responded to more than 1,400 calls. Again, while any case of COVID-19 in our state is concerning, most New Jersey residents are still at very low risk of contracting COVID-19. As we are still in the midst of flu season, it is more likely individuals with respiratory symptoms such as sneezing and coughing and temperatures have the flu or maybe the common cold. Unless you have traveled to impacted countries or come in contact with someone who is known to have COVID-19, your risk remains low. We cannot say this enough. Please protect yourself and others from the spread of respiratory viruses by washing your hands frequently for at least 20 seconds, using alcohol-based hand sanitizer, covering coughs and sneezes, and please stay home if you are sick. Again, we understand the public is concerned, especially now that 2 cases have been identified among our residents. But we have been and continue to take all steps available to us to protect our residents. Thank you.
Thank you, Commissioner Persichilli. And at this time, we will hear from Dr. Christina Tan, who is a state epidemiologist, and she oversees communicable disease services at the New Jersey Department of Health. Dr. Tan.
Thank you, and good afternoon, everybody. Just really briefly, the complete clinical picture regarding COVID-19 is not fully understood at this time, as we know. Reported illnesses have ranged from mild to severe, including illness resulting in hospitalization and death. And while information so far suggests that most COVID-19 illness is mild, a report out of China recently suggests that serious illness occurs in about 16% of cases, which means that the majority of cases do present more with milder symptoms. Older people and people with certain underlying health conditions like heart or lung disease, diabetes, seem to be at greater risk for serious illness. Worldwide, there have been very few cases reported in children, and of those reported, the illnesses have been mild. Much is also unknown about how the new coronavirus that causes COVID-19 spreads. Current knowledge is largely based on what is known about similar coronaviruses, which are very common. And generally speaking, coronaviruses are a common cause of mild to moderate upper respiratory illness. Most often, person-to-person spread is thought to happen among people who are in close contact, meaning defined about 6 feet with each other, occurring mainly through respiratory droplets produced when an infected person sneezes or coughs, similar to how influenza and other respiratory pathogens spread. So, again, this is a rapidly evolving situation, and risk assessment of COVID-19 will be updated as we have more information. And while we currently have 2 presumptive cases in New Jersey, the risk still remains low for our general population, but it is still slightly higher for those New Jerseyans who have traveled to areas where community transmission of COVID-19 might be occurring, and for those who have had close contact with confirmed cases. And the increasing number of cases in other states and now in New Jersey make it more likely that we will see more cases in the near future, particularly since more people are being tested, as the Commissioner had stated. New Jersey, we're no stranger to emerging infectious diseases. And as we are a hub for global travel, over the last 20 years, for example, New Jersey has seen imported cases of SARS, viral hemorrhagic fever, and Zika disease, just as kind of our more recent examples. And also, back in 2009, we experienced the H1N1 pandemic when over the course of a year, we had over 3,000 confirmed H1N1 cases, mainly impacting a younger population. Similarly, as COVID-19 continues to evolve worldwide and domestically, we are carefully monitoring the situation and learning more about COVID-19 every day and adapting what we need to do as needed. And right now, we are seeing that different areas of the United States are going through different stages. So, for example, in California, in Washington State, there is evidence of sustained community transmission in which these states are taking additional steps to control COVID-19 spread. In New Jersey, we've just identified our first 2 presumptive cases, and here in New Jersey and in surrounding cases, we have not yet identified sustained transmission in community settings. There are public health strategies that can help contain communicable diseases such as COVID-19. And right now, as we have started to get COVID-19 cases, we work with local health departments and healthcare providers regarding contact tracing and assurance of appropriate infection control processes in healthcare facilities. But again, we do expect that we're going to see more cases. And as that happens, we are going to have to shift toward different strategies that help mitigate the spread in the community, because we're just similar to what other more heavily impacted states are doing right now, because we have to be mindful of prioritizing our healthcare resources. Community-based interventions can help slow the spread of coronavirus, and those interventions might include the personal protective measures that the Commissioner had mentioned, those everyday preventive steps like hand hygiene. There are also measures to increase social distancing, such as social distancing in the workplace or school dismissals, for example, and environmental measures such as enhanced cleaning of frequently touched surfaces. And with that, thank you, and those end my remarks.
Thank you, Dr. Tan. I'm going to now ask Chris Newworth, the Assistant Commissioner for our New Jersey Department of Health.
Good afternoon. As we expected, there are many individuals who are interested in being tested for novel coronavirus. Currently, the state lab is the only laboratory in New Jersey conducting tests. As of this morning, we have received a second test kit from the CDC to test an additional 216 patients. We are only testing individuals who meet the CDC criteria for persons under investigation and who have been authorized for testing by the CDC. The time frame between a patient arriving at a healthcare facility to receiving the novel coronavirus test results can be up to 72 hours, considering the necessary approvals, specimen collection process, transportation of the specimens to the lab, and associated lab processing times. In our effort to increase testing capacity across New Jersey, we will be sharing guidance for licensed clinical laboratories to establish their own capabilities for novel coronavirus testing. Once external laboratories are authorized to conduct testing on their own, we will reevaluate PUI testing criteria to reflect our enhanced testing capabilities. Please continue to monitor nj.gov/health for the latest information and guidance for laboratory testing. Thank you.
Thank you, Chris. Now, we have with us today Dr. Sawchuk. Dr. Sawchuk is MD, and he is the regional president of the Northern Market for Hackensack Meridian Health.
Thank you, and good afternoon. Last evening, Wednesday, the New Jersey Department of Health notified Hackensack Meridian Health that a patient at Hackensack University Medical Center tested presumptive positive for COVID-19. Rest assured that our team of dedicated healthcare providers has taken every precaution in treating the patient. We are working closely with the New Jersey Department of Health in accordance with protocols provided by the CDC, including isolation of the patient, use of dedicated equipment, and appropriate personal protective equipment. Our patient is resting comfortably and is doing well. Hackensack Meridian Health continues to screen patients in accordance with CDC guidelines. We are routinely engaged in emergency management practices and prepared to manage confirmed cases of COVID-19. Thank you.
Thank you, Dr. Sawchuk. And we have with us as well Attorney General Grabir Grewal.
Thank you, Governor. I want to thank Governor Murphy, Acting Governor Oliver, Commissioner Persichilli for their leadership with respect to the state's coronavirus response. I'm here in my role as the Chief Law Enforcement Officer for New Jersey and as the individual responsible for our state's consumer protection efforts through our Division of Consumer Affairs. And I'm here with the simple message for any business or person that seeks to profit from consumer fears of this coronavirus. Simply, don't do it. We take seriously allegations of price gouging. We take seriously allegations of those who might be making misleading claims with regard to the efficacy of certain products to treat or prevent the spread of the coronavirus. And our investigators are out there in the market now, spot checking pharmacies and other businesses for this type of conduct. But unfortunately, I have to report that we've received a number of complaints over the last number of weeks concerning businesses who are engaged in price gouging on products ranging from surgical masks to hand sanitizer. And to date, we've issued 10 complaints or 10 warnings to these businesses to cease these practices. So if anyone suspects that a business is engaged in this type of conduct or making misleading statements, I encourage them to visit the website for our Division of Consumer Affairs, njconsumeraffairs.gov. You can get more information there about scams that we have identified in the wake of this public health crisis, and you could also report businesses that are engaged in improper conduct. It's simply unconscionable that businesses in our state, to include pharmacies, are seeking to profit off of the fear of the public at this particular moment. So we stand ready, our inspectors stand ready to root out this conduct and to hold these bad actors accountable. Thank you.
Thank you, Attorney General. We'll now hear from Colonel Pat Callahan, the Superintendent of our New Jersey State Police.
Thank you, Governor. And I'll just briefly re-echo my remarks that I gave Monday, just a few short days ago, with regard to the state police's role. I know some folks in the room may wonder what the state police has to do with the coronavirus, or whether it was Ebola or SARS. Our role as one of 2 states in the whole country that serves as the Office of Emergency Management is why we're involved when I speak about preparedness and mitigation, response and recovery. as the commissioner indicated and the governor indicated, we've been preparing for this for several weeks now. And that is the primary pillar of emergency management, regardless of the hazard or the disaster. So the efforts that we lend toward preparedness and mitigation will hopefully make us much better in the response and the recovery approach to this. As the commissioner indicated, it's probably even though the second presumptive case has been identified, we probably can expect more, and the state police and all of our partners assembled here today and throughout the state remain poised and prepared to handle this situation with the utmost fortitude and diligence. Thank you.
Thank you, Colonel. And we'll have a brief Q&A. Yes. We are still doing investigatory work with those two individuals, so we're not prepared at this time to give you that type of information. But in the following days, maybe we can respond to that. Yes?
Can you tell us where those individuals were? I understand
as you heard Commissioner Persichilli say, that we do know the movement of one particular case where he and it basically was traveling within the city of New York. The second presumptive positive case is still being investigated. Yes.
Is there any link with Bergen County and the other presumptive positive cases in New Jersey, any other?
We don't have that information at this time.
And if I may follow up so that we understand what presumptive positive means, does that mean the state first tests?
Correct.
Can you elaborate on?
Yes, and then we are required to send the samples to the Center for Disease Control, and as our federal disease control center, they then will affirm. Yes. Yes, yes. I'm going to let
Let me try to clarify. We know a little bit more about the first individual. The second individual, like I said, we just heard about a half hour ago. So the first individual was someone who worked in New York, 30-year-old person, worked in New York, and then was hospitalized at Hackensack. We know his movement was primarily in New York. He was not feeling well, came home to his dwelling, and on the night, about 10 p.m., on the 3rd, I think it was, he went to Hackensack. The second case I have absolutely no information on yet. It'll be forthcoming. I just want to share with you the process. When we get a presumptive positive, the reason we send to the CDC for confirmation, it's because these are new tests, it's a quality control aspect of the testing. But when we get a presumptive positive, the first thing we do is call the local health officer. The local health officer calls the physician, the treating physician, so that the treating physician can inform the patient or the patient's family, depending on the condition of the patient. That process, particularly when it's 10 o'clock at night, can take longer than we would like. But we try to hold that process private and confidential, because we do not want, and this has occurred, that a patient hears about themselves on the TV before the treating physician, who that patient has that relationship with, has the opportunity to share that information. So we need a couple of hours for sure from the time we get a positive to the time it's released. So the second case is just breaking. We felt compelled to tell you about it. We didn't want you to leave here today and hear about it an hour from now, but I don't have any information on it. It's north. It's in North Jersey. Not that we know of, but we haven't done the investigation yet, but not that we know of.
Commissioner, you had mentioned earlier that people are being brought into the emergency rooms and then isolated. Could you kind of take us through what the process is
Certainly. The first step is, and we've been telling people, if you feel sick and you believe for any reason that you may have COVID-19, call your healthcare provider. They'll direct you to the emergency room. Call the emergency room. Because the emergency room wants to know you coming in that front door. And the minute you hit that front door, they protect you and the other patients and put you into a negative pressure room. Our survey of the hospitals in New Jersey, every emergency room has the appropriate isolation room for these patients. And maybe Dr. Sawchek, you can talk about it from there. The infection preventionist is called, the infectious disease specialist. You can.
So,
Doctor, could you give us your first and last name spelling, please?
first name is Ihor, I-H-O-R. Last name is Sawchuk, S-A-W, C like in cat, Z like in zebra, U-K. So when a patient comes to the emergency room, there are screening protocols. There are questions that are asked to determine if the patient is a positive screener. If so, then there are precautions taken for the patient and for the team members. The patient is put into a negative pressure room, and the policies and procedures are followed. And, you know, Hackensack University Medical Center takes great care of its own team members. We've been drilling for biohazards since Ebola, and we're well aware of what it takes to manage these type of patients.
Could you briefly just give us the policies and procedures, like do they wear protective clothing when the patient comes in? Is it mostly on the face?
They have protective clothing. They have an N95 mask. They have the protection around the face and the eyes. And we use dedicated equipment in those rooms. Equipment does not come in and out, and we use a limited number of personnel to work with the patients.
Do those people get specific training, doctor, about how to deal with this situation, or how does that go?
Yes, they get specific training, and they have ongoing training.
And final question, if I may, sir, the negative pressure room, what exactly is that? How does that work?
So that you need an engineer for.
I'm not an engineer. Just play one on TV. I'm not an engineer, but the negative pressure rooms actually turn the airflow into the room, not outside the room. In most cases, in positive pressure, airflows go outside and they go throughout the department. In negative pressure, it's inside and shunted outside of the room. There's 6, in the older rooms, there's 6 air changes an hour, and in the newer rooms, there's 12. So it's constantly moving.
Can you give clarification on hospitals here? Are these 2 people both at the same hospital?
No.
What's the whole name of Hackensack? That's what's been reported. We just want to make sure that's correct.
That's incorrect. We definitely know Hackensack. The other is Englewood.
So can I just adding on that then? Holy Name, there's a spokeswoman there saying that they're investigating a possible case. Can you expand on
Well, we
that?
have about 11 or 12 possible cases being investigated right now. I can't tell you every location, but we're constantly getting calls.
The first one is at
The man,
Englewood,
the
the
first
second
man,
one is at
he
Hackensack.
was traveling around New York. He works in New York. Was he on the subway? Was he on the public bus system?
I don't have that information yet. I don't have that information. But we are working with New York, by the way, on any case that, like the Westchester, anything that traverses New York to New Jersey, we're in contact with the New York health officials. So I don't have that information.
Okay, we're going to take one more question, and this gentleman. The results, as soon as we get confirmation from the CDC. Oh, it will be several. Yeah, yes.
I'm sorry, several days or several
I said hours.
Can you also just give us an idea? A bunch of us poured a lab and that was just trying to get clearance to test, and I know it was discussed about trying to broaden so tests can happen. What is the holdup? Because obviously that lab and Nellie that's fully prepared to test has not gotten clearance. Do you know with the
Yes, Chris Newworth will give you some more detail on that.
So by close of business tomorrow, we will have guidance for those third-party, those external licensed clinical laboratories, the process outlined for them to proceed forward with bringing online the capabilities to test for novel coronavirus. As in New Jersey, those laboratories are licensed by the Department of Health. They have to go through a relatively short process to add the ability to test for novel coronavirus onto their license. And so we're working with those entities that would like to do that so that they can come online as soon as possible.
Just to clarify, I'm sorry, I heard you say you're going to have 8 open tests that you're waiting results from, or was it 11 or 12? I heard both numbers, just wanted to be clear.
How many have been?
Well, you just said 11 or 12 investigations. I don't know if that includes the 2.
11, we've tested 13 individuals. 11 were negative. Oh, yeah, well, but I want to make it clear.
Yeah, Judy, if you want to use, they can't hear you.
Right now, we have tested 13 individuals. 11 were negative, 2 now positive. But Dr. Tan reminds me constantly that these numbers are evolving. As we're sitting here or standing here now, more than likely, more tests are being done. So that's as of 2:30.
As of your last check, how many test results are you waiting to come back on that are not conclusive yet? Not including the 2.
How many, we have none in the queue? None in the queue at this point.
I thought you said 8 earlier. I apologize.
8 persons under investigation awaiting testing. That's, oh, yeah.
So as of this very moment, we have tested 13 individuals. 11 have come back negative. 2 have come back positive. And right now, at the state lab, we are not testing any additional novel coronavirus specimens. Now, the way the process works, though, the Communicable Disease Service, in consultation with healthcare facilities in New Jersey, are fielding calls and making determinations in coordination with the CDC to identify others.
But we
But
have,
right
I'm going to clarify the 8. We have 8 persons under investigation. They haven't been determined to go to testing yet. So I'm sorry for that confusion.
And we want to let you know that the Office of the Governor is committed to being open and transparent with the public. As information that is verifiable has been provided to us, we will certainly be informing the public. We're not hiding anything or keeping anything unreported, and you could anticipate getting reports from the Office of the Governor when it is necessary. But I want to thank all of you for coming this afternoon.